Welcome, everybody. I'm going to ask people to take their seats. Maybe grab an extra spring roll or extra water. Make yourself at home. Beautiful. Wow. So, my name is Catherine Gergen-Barnett, and I feel so honored to be joined by all of you this evening. We are also on live stream, so we have friends joining us from afar, and we can send this out. So this is really about joining together so that we can harvest and pass on. So really wanting to make sure that this evening doesn't end here. So everybody here knows that we have been working collectively for over 2 years to think about how stories can be gathered in order to try to heal communities. We know we don't have to do any more proof building that there's so much distrust that exists in our medical system. And there is no amount of good that can be done for all the harms for so many generations of the past. But our goal here tonight is to gather so that we can not only honor the storytellers that have shared so bravely and so honestly their stories about their experience through healthcare, both positive and negative, but we are here so that our collective imagination can move us forward towards a better healthcare system and towards healthier communities. So we actually have set up all kinds of stations where we're asking for your tips. And we also, when you registered, you each gathered some tips for healthcare providers and as patients, and we're harvesting all of those, but even that's not enough. Where is this gonna go? How are we gonna build this into curriculum? So we're actually working right now with an amazing group of folks, some of whom are here tonight, to build this curriculum for future medical students, for future physicians. But it's also about how do you pay doctors differently so they actually are doing the right thing. So we actually have representatives here from MHQP, which do a lot of the measurements of healthcare. So we can actually change those pieces. But more than anything, it's about building relationships. So I will say this is a collective. I just happen to be standing up here. I'm from Boston Medical Center. I work so closely with Everyday Boston. You're seeing sweatshirts. And Kara, who doesn't love public speaking, but she is next to me. Kara, where are you? Yeah, woo! Okay. And then we have the Black Project that has been a critical partner for us. The head of the Black Project is actually with us. She's had a long and difficult day, and so she sends her blessings for us in this journey. We have Transformational Prison Project. Anybody, folks from TPP want to stand up? You're in the house? Okay, yeah, there's Eric. One of our partners is We Got Us. So we have some representation from We Got Us, yes. M-Vision is a partner. I don't think they could join us tonight, but they actually helped curate some of our films. So I'm going to actually show you that over here, you can sit and you can listen to some of the videos too. And we have QR codes for those videos. And we have a website where you can be watching those videos, you can read stories, and you can see a lot of our collected stories over here as well. I also want to thank SEAL team and BUCTSI, who've been amazing partners on this work. So thank you. So I really don't want to leave this moment without also dedicating and honoring a great visionary, a trailblazer, a pioneer, Mel King, who we know was really important and transformational for the work that we're doing here tonight as a collective. I will say that Justin Petty, who's in the back and couldn't come up because he's doing an amazing job filming, shared some words with me. He's actually was his fraternity brother and worked with him at Roxbury Community College, and in fact was just honored with him very recently, and talked about how Mel was really not about me and was really about us. So may we be here tonight and honoring Mel's vision of us and move forward on that note. So without any further words from me, I'm going to introduce Kareem, who's going to be facilitating our panel.
Good evening, everyone. Thank you all so much for joining us today for this really important and transformational event. My name is Kareem King. I am a senior at Harvard studying history of science and medicine on the pre-med track, so future doctor in the making. But I also serve as the community engagement director of We Got Us. We Got Us is a nonprofit out of Boston that was started to really help our community address certain issues around vaccine access when it first rolled out in 2021. And a big part of what we do is focusing on medical racism and the ways that we've seen these historical instances and modern day instances of racism play into the healthcare space. Whenever we go out in the community, one of the biggest things we say is first acknowledging that, because it's such a huge issue, especially for Black, brown, indigenous folks who utilize healthcare. But tonight we want this to really be about ways that we can come together to address those harms, think about a shared vision for moving forward as a community to really restore trust in the health system. Now, before we get started, I want to first acknowledge, or take a brief moment to acknowledge that the topics we're gonna bring up today can be triggering for certain folks. This is talking about people who have experienced the medical system and potentially been harmed by it in different instances and situations. So if at any point during tonight you need to take time for yourself or just take a moment to pause and really collect yourself, feel free to do that. We also have Pure Spark in the building tonight, who the founder executive director, Naisha Deed, will be on our panel. So if at any point you need to talk to someone, you just need resources, feel free to visit her table. All right, and with that, we can get started with our panel discussion. Today we have 5 amazing panelists, which I'll invite to come up now to begin the conversation. Okay. All right, so just to give everyone a rundown of the event, we have these 5 amazing panelists who are community leaders, physicians, and business owners working to restore medical trust in their own spheres throughout the Boston community. This discussion will last roughly 50 minutes. So essentially we'll introduce each panelist along with one question that we want to ask them based on their expertise. And then we'll offer 20 minutes at the end of the conversation for audience Q&A to really answer any questions you guys might have or thoughts you might have around addressing this topic. Are there any questions or thoughts before we get started from anyone? Okay, well then with that, I'll offer the panelists time to come up and yeah, we'll get the panel started. Okay. So our first panelist we'll introduce is Dr. Glory Ruiz. She's a physician at Boston Medical Center who's been working in our communities to basically address some of these issues in her own spheres. So our question to you, Dr. Ruiz, is as a physician, what do you say to patients who've encountered negative experiences with former doctors? And I also wanted to ask you, what is BMC doing intentionally to bring community voice into restoring trust in the medical system?
Okay. Good evening. My name is Glory. Please call me Glory. I've been at BMC for around 17 years, and I think to your first question, I think we haven't done enough is the first that I would say. I did train as a physician, and I did train as a physician in Puerto Rico. And I did not receive a lot of the cultural awareness training that I think is really necessary to be humble, to be sure that we tap into our implicit biases that we all carry. I think it is important that we peel away. I think in the Latino culture particularly, there's like this kind of sense that the doctor knows it all and just almighty almost. And I feel that we need to make room for more equal conversations where there's no power dynamic, and also make sure that we also leave room for the teas of the garden and like those the things that are carrying on from generations to that we all know. I mean, I did drink antibiotics for treatment, but I also had my grandmother make me tea with cilantro, and it tasted horrible. But you get what I'm saying. I think it's important that we learn a little bit more about that. In terms of your second question, what is BMC doing? Here's one example. And I think is making sure that we learn from our mistakes and also make sure that we incorporate this as a curriculum and make a health equity front and center of every patient interaction.
Yes, thank you so much for your comments. And I really loved how you talked about how we want to make sure that we're bringing in the Western perspective as well, but also thinking about how traditional medicine plays into providing for the health and well-being of our communities. Yeah. So thank you.
Yeah.
And with that, we'll move on to our second panelist, Shakira Robinson. So many of you may know her from the work she does in the community with Shakira's Story, where she does domestic violence consulting and coaching. But she also works in public health and works to address some of these issues in her sphere as well. So the question I want to ask you, Shakira, is how do you see community engagement work contributing to dismantling medical mistrust?
Good evening, everybody. I just want to specify I'm here in this space as a community engagement specialist with MAP. So let's just bring that in. But in terms of community engagement,
Oh. Do I have to, is it like a...
Anyhow, good evening, everybody. We're doing it again. I got to bring it a little, here we go. Thank you, brother, thank you. In terms of community engagement, there's so many things that are happening, such as this, bringing education, awareness, and information to communities that are hardest hit, making sure that we're breaking silos in terms of bringing those different groups and populations that are most impacted. So let's talk about our BIPOC communities, let's talk about our LGBT communities, let's talk about our elders and our young people who are missing this information because they're either misinformed or they're not being brought to the table in terms of access. There's a lot of conversation about diversity, equity, and inclusion, but it's happening without the people at the table.
Roots to Wings, a nonprofit support group for grandparents, households. She also advocates for the rights of grandparents to help secure resources when they're taking care of children. And she's also one of the people who shared their story with us tonight about her journey with medical racism and the ways that she's worked to rectify that in her own space. So with that, Cheryl, my first question to you is, from your own experience, what kind of things have doctors done to create mistrust or to address your trust?
First of all, they have to see me as a person and not as a billable hour. They need to recognize that I am definitely a black woman that has a long history, a long culture, and it may not be your view of what you see as the patient that's worth your time and attention, but I know that I certainly am. But it took me a long way to get to where I'm at this point right now, and now that the anger has subsided, because I'm in the care of good medical professionals who don't see me as a billable hour, but see me as a person and truly address my needs. But let me tell you something, though. This whole thing about medical mistrust seemed to have come along as a point of the vaccine. But this has been going on with me for years and years and years without a vaccine. But my whole thing is, listen, we know that mistrust came up behind the government in the vaccine. But my biggest problem was that it was the providers that were not given the proper information, education to say, okay, let me build a relationship with you so that you don't necessarily have to trust the government, but trust me because I care for you. But if I feel like you don't care for me, then I'm not listening to anything you say. This has come about because of experiences that I've had. I left a medical institution after over 20 years because I felt so disrespected, underserved, and not treated well. I wrote the doctors a letter to say, I'm leaving you because, and I listed every reason why I wasn't going to be there anymore. Just by chance found an amazing doctor. But the thing for me is a black woman, 77 next month. It's like, where does this come from? These feelings don't come from overnight. You know, West Indian parents, everything. It's like, where do you get your strength from? But you know what? They keep trying to beat us down in the medical profession because they treat you like you're less than, and that says you don't care, to the point where your spirit, your soul gets broken. But you know what? We're resilient. We are resilient. And I'm just here to tell you that no matter what your experience, because I so badly with the, I'm just going to tell you this story and then I'm going to stop. I was in the hospital and I was in the second bed. These doctors came in who were my doctors. There was a woman who just happened to be a white woman, a lovely, lovely woman. Her name was Lois. And they came in and they said, hello, Mrs., and called her by her last name. They stood there, they chatted with her, they asked her about how she was feeling, whether the room was warm enough for her, and they come over to me. Now, supposed to be my care team. They come over to me and said, Cheryl, how you doing today? I said, what? You know, I didn't even get a Mrs. I didn't get no chit-chat, nothing. Right away, Cheryl, how you doing today? So right away, that said, they're interested in me. They're interested in how quickly they can take my temperature, do whatever they need to do so they can go write a note and the hospital can get paid for them spending 5 minutes with me. That's the kind of thing that breaks your spirit. That's the kind of thing that people of color go every day. It's not even a matter that it's so blatant that you see it, but you have to, I guess, get to my stage of life to really recognize it, to say there's something that's just not right about this. It just doesn't make me feel good. And if I can't feel good, it's supposed to be working with me, help me, then there's something wrong with that picture. The hospital that I was at, a certain way, that I wasn't going to get treated a certain way. So every time I went to see the doctor, I put on my Sunday best, went and got grandma's pearl earrings out of my, it was just a terrible experience. Like I had to do something more than be me just so that I could get treated right. You know, these are the kind of things that when we talk about medical mistrust, and all doctors are not bad, but listen, if you can't make me feel like you're there to help me, how am I supposed to trust you? But yet you want me to trust you for you to write a prescription without even understanding, because you haven't heard me when I've said to you, this is what hurts. And it may not even be a physical hurt, but it may be an emotional hurt that you're creating because you're telling me, I don't care. So it's a whole great big thing. I just want that. It's nice. Thank you all for coming. But for me, conversation is just that, without action. So what has happened? Somebody that looks like me, that talks like me, that has a mouth like me, doesn't get turned off by the medical profession, because really they don't want you asking questions, and they certainly don't want you even acting like if though you know that they really don't have you in their best interest. So I could tell you a lot of stories about why I do not trust the medical profession. And you know what? The biggest thing for me is that it's not the people per se, it's the system. I truly believe that racism, like everything else, is intergenerational. So for you to become a doctor, it says to me that maybe your daddy, your granddaddy, your mama's a doctor. But whatever values you were raised by in that household before you went to university to get that MD in that white coat, that's still within you. And it shows. It definitely shows. And I think that in order for doctors to hear, they need to be able to listen with their heart and not with, you know, what the prescription calls for. I don't like being a box that gets checked off. I don't like the fact that when you enter the room, the first thing you say to me is, I'm Dr. So-and-so, and Cheryl, how are you doing? So right away, you're putting up an unnecessary. I have a doctor right now that is a pulmonologist. And the very first time I met her, she came in and she said, hi, my name is blah, blah, blah. Never said no doctor, never said no nothing. She sat beside me as close as Shakira is to me here, and she put her hand right there, and she said to me, so how can I help you today? I fell in love right away. I said, how can you help me today? Well, let me tell you. And from then on, we've had an amazing relationship. But my whole thing is that you need to speak up. And you know what happens? We are so afraid of the doctor, number one, thinking that he's God. We worship him like he's God, and then he's acting like he's God, that we don't want to say anything because we know he may get mad and not pay any attention to us at all. So we don't say anything. We go away feeling like we haven't been treated, feeling like we've been mistreated, and the disrespect is just like off the chart. So we need to speak up. We need to tell these doctors not so much what they can do for me, but how we can work together so that my expectations for quality health care are your expectations, that you're going to give me that. And with the two of us in partnership, that we, in fact, are going to help me get better. Because, you know, all the degrees in the world does not give somebody a heart. And I think that doctors and other professional people that look, especially within the minority community, like if though we don't know any better, so therefore we don't deserve any better, and that means you don't even have to discuss anything with us because we're not going to understand it anyhow. Well, I'm here to tell you I understand it. And there are a whole lot more people like me that understand what's being said. But more importantly, we're feeling what you're not saying. And what you're not saying is that I really don't care. And all I want is for someone to care.
Thank you so much, Cheryl. You shared so many good things during your conversation. And I think one big thing you brought up is how one big thing that you brought up for us today is how we have to make sure that within the medical system, we're seen as humans first.
That's right.
You can't treat a patient without understanding how they are the person coming into your space and coming to you for help. And also it needs to be a team effort. So you can't have someone telling you what you need to do to get better. It has to be a conversation between both people about how to develop a plan. Oh, thank you. And essentially the ways that you both can work together to make that happen. So thank you so much, Cheryl, for sharing your story. With that, we'll move on to our next panelist. One quick thing I do want to say is, while we really value each this matter, please make sure that you keep your remarks to about 5 minutes so we have time to get to everyone.
You should have told me that before.
But yeah, I didn't want to interrupt you. It was really good, so just know that. All right, we'll move on to Tyrone Mack now. So Tyrone Mack is another person who shared his story with us tonight about his journey in the health system. He's also worked in the medical field for over 20 years? Off and on, yes. So he has experience working in this space, but he also understands, as a black man who's been in this space, what it looks like to be harmed. And he wants to talk to y'all a bit about his experience tonight. So I will give you the floor, Tyrone, if you have anything you want to say to the audience.
But first of all, let me just say this. I would like to just say, when it comes to Boston Medical, and when it comes to the positions that I have now, as they tell me, I'm passionate about you because you're passionate about me when you come.
That's right.
I had some bad doctors, but I've learned to advocate for myself. See, I learned that I'm not a color. I'm a man first.
That's right. That's
Yeah.
right.
And two,
Take your time.
I had some doctors that really didn't do what they should have done as far as communicating with me or allowing me to be on the same page with them, because when I got sick, I didn't know what's happening, and I almost died several times. I went through multiple doctors. It took a special doctor to really sit me down and let me know what it was and told me, I'm going to ride with you. I'm here with you.
There you go. That's
And at first, I didn't trust the system. I didn't trust the system. It took the people that was there to show me that what I was doing, what I was fighting for, was worth it. Because when you go there and you don't know what's going on with you, whatever they tell you, you're going to take it.
right. That's right.
It took a doctor to sit me down and let me know that I was worth fighting for. And the way that I fight for others, I can fight for myself. But the same way I'm talking to her, she says that I can talk to the rest of my doctors.
That's right. That's right.
I asked for help to get a team together. So nobody can do anything without my doctor knowing first. And this way, our communication will be on the same ground.
That's right.
Because you don't know what it's like, and when you're laying there and you're dying and you're fighting and no one's telling you anything that you can understand, and then when you go to another doctor that you never had and they tell you, hold on, I'm going to take your case.
Yeah. Yeah.
I need you to tell me what's going on with you. But first, before we do that, how are you?
That's right.
Got to know me. Earned my trust. Now, that doctor's not a doctor to me. That doctor's family. Because that doctor kept me here for my grandkids, my mother, and have me here so I can take care of everybody else around me.
That's right.
So I try to teach people the things that I went through. I don't guide nobody. I just put the information there.
That's right.
And if you need my help, if I can do it, if I have to crawl to do it, I'll do it. Because at the end of the day, Dr. G, you didn't have to do nothing for me. Year after year, day after day, appointment after appointment, complaint after complaint. Only thing you did was sat there, you heard me, you treated me, and you told me, we're going to work this out together. And when I came to see you, I was having so many seizures, Every time I used to come see you, you were scared for me, but you never showed it. You always told me, we got this. It was 2 years since the last Caesar. I thank you.
Thank you so much, Tyrone, for sharing that story with us.
But if anybody got any certain questions, specific questions, believe me, you can catch me afterwards, or you can ask them, and I'll give you an honest answer.
Yes, all the panelists will be here after conversation, so if y'all want to talk to them more about anything they mentioned today, please feel free. All right, and our next panelist we'll introduce is Eric Anderson. He's the Director of Communications and Special Projects for the Transformational Prison Project. Their mission is to provide a space for those who have been harmed or who have harmed at the hands of mass incarceration to come together and have a dialogue about how to address those harms using restorative justice practices. He also mentors students through Roxbury's District Courts Choice Program, and he's really been a leader in the Roxbury space to help youth and people. With that, my question to you, Eric, is how can restorative justice address medical trust, or what are the ways that you've done that with Everyday Boston?
This is working, all right. I think I love the way Cheryl put it. A doctor's a human being before they go into practice, before they go into school. And I think in restorative justice, especially what we've been able to do behind the wall and out here in the community, is create spaces. A space where you can share your story. A space where a doctor can actually hear you, where they can share their story, where you can be honest with each other and really build. I think that is what's really needed, and to really deal with the medical distress and what we tried to offer in our circles a couple years ago. Just the opportunity for individuals to honestly share their story. Like I put up there, the best thing for a patient to tell a doctor is the truth and not be afraid. Don't be scared. Just tell them that thing on your leg is bothering you and go figure it out. So for me, just really as simple as that is creating a space where everyone's valued, where those true values you bring from your home are honored, and where everyone has that voice to be able to speak. And that means both ways. Because if I talk all to a doctor and they don't speak back, I'm going to the next one. Right. So for me, it's always been that. And I enjoy both what you said. It's really speaking up for us. We have to speak. If we don't use our voices, if we don't tell them how we feel, we're never going to get anything. Bobby will tell you, it took us a fight even to get our teeth cleaned in prison. They told it was cosmetic. We couldn't get just the scrapings. But it's actually something you should do every 6 months. We had to file suits to get that done. So it's really, and it took individuals speaking about it, individuals stating they're not having it, then for the legal person in the prison to say, you know what, let me put this work in. You know, everyone's talking. I see the problem. I can make the solution. So it's just really using our voices and honoring our values and creating those spaces for us to be able to speak. And thank you for your work.
Thank you, Eric. And I really like how you pointed out this idea of creating spaces in our community to care for ourselves. It's something that Cheryl alluded to earlier as well, but we've already been doing that for so long through various organizations and initiatives that our community has started to provide for our own health and wellness within a medical system that doesn't always do that for us or hasn't done that for us for so long. So thank you for bringing that up. And with that, we'll move to our last panelist, Naisha Deed. She is the founder and executive director of Pure Spark, a social media nonprofit that helps with mental health and wellness and inspiring that through daily social media posts and providing content to our community, specifically geared toward Black women, but really it's for anyone who's seeking mental health help. So thank you so much for joining us, Naisha. And my question to you is, why is mental health so important to consider when we talk about medical mistrust?
Hello? Okay, I wasn't sure. I was like, oh God, the trauma. So first of all, I just want to clarify that Pure Spark, although we are definitely focused on social issues such as mental illness and mental health, trying to kind of further folks' mental health, we are not a nonprofit. We are actually an LLC. There's a reason why I chose that legal structure, but that's another story for another day. But out of curiosity, how many doctors do we have in the room? Just out of curiosity, like raise them all the way up high. Be proud that you're a doctor. Like, why are we not proud? And how many folks in here have been harmed or have concerns around medical mistrust? I'm just curious about, okay, we got, okay, curious. So most of the folks on the panel really spoke from the physical side, right? And I think a lot of times when we think about health and wellness, a lot of us oftentimes think about our physical well-being. We don't necessarily consider that actually our like mental health is all a part, it's like all connected, we're all connected, right? So there's a couple of things that came to my mind as people were talking. I want people to remember that you are hiring these people, right? Like, let's remember that we have power, right? Like, I don't want people to forget that we have power. Sometimes we forget, like, oh my goodness, like, actually, I can fire this person.
Yes.
Just like you can fire your therapist, right? Or you can fire your dentist. You don't have to stick with the person that's not treating you right. It's a relationship. Just like when you're in a friendship, whether it's romantic or not, like if it's not benefiting you, you can leave. At any point in time, you don't have to stay there. I want people to remember that. That's number one, when I'm thinking about like empowerment, right? Number two, when I think about my wellness, I think about the fact that it's my priority to take care of my wellness. So like, and I know this is different for everybody, but like, what am I putting into my bodies? Like, what am I doing so that I don't have to go there that often, right? Like, because, you know, the goal is not to be in the hospital all the time. I know, and I obviously know there are some things that keep you going to the hospital for, you know, different reasons, whether it's emergency. But the goal for me is not to be in there like that, right? You know, so number two, what can we do better to make sure that we're taking the best care of ourselves possible? You know, what kind of foods are we putting into our body? What kind of movement are we doing to make sure that we're getting those steps in? And I know it's sometimes hard, like some of this stuff is a luxury, especially when you're working long hours, you gotta go home, you gotta do all these things, but just something to kind of remember. But, you know, I'm a woman, obviously a Black woman, that was diagnosed with a mental illness in 2008. I was diagnosed with bipolar disorder, and I was so afraid because not only was I Black, that was strike number one, I was a woman, and I was now given a mental health diagnosis that's very much so stigmatized. Oh my God, when Kanye West came out, it's like, oh my goodness, here we go, all the jokes, and it's like, I hated it. And there is a perception that if you're dealing with a mental illness, right, you know, it's weaponized, you know, and a lot of times if you're experiencing certain symptoms, you're not seen as a human, you know what I mean? And so I think it's very important to know, I don't know how many folks in here are dealing with mental health struggles, but know that there are advocacy organizations out there, one that I love, which is NAMI. So if you're dealing with issues when it comes to treatment, whether it be in the emergency rooms or inpatient, they are a great organization to call to say, hey, this doctor, this person, this group is treating me a certain way, I don't feel safe, and they can kind of connect you, whether it be with folks on the NAMI side, and NAMI is a nonprofit, National Association of Mental Illness, or they can kind of direct you of like who you should be talking to within a hospital. Because there are, I remember a friend of mine saying like, you know, well, who do you call when the police does something harmful to you? Well, you call the police on the police, right? So if something's going on in the hospital, hopefully there's somebody within the hospital that you can speak to say like, hey, this is what just happened to me, right? And being able to do that kind of reporting. So again, number one, you could fire these people at any time. this is not right. Number two, let's make sure we're doing whatever we can to take care of our health. What are we eating? What are we watching? You know, how are we moving our bodies so that we don't have to depend, because dependency is a very dangerous place to be, right? On a system. And then number three, if you have to be there and something does go wrong, knowing the options of who to tell and who to talk to, so that, you know, this stuff gets reported. We can't just let it go without being reported. Thank you.
All right, thank you so much for sharing, and for all of you for really bringing in your stories and your experiences to this conversation. At this point, we're gonna move into the audience Q&A. So if anybody has any questions they'd like to ask the panelists, we'll have around 10 to 15 minutes to do that. So feel free to just raise your hand and we can get started. Yes, in the back. Should we bring him a mic? Or?
Ready? Thank you so much. What a great discussion. I'm in several groups. I run a nonprofit organization, and I'm a community activist. I'm from the Caribbean American community. Hey. One of the things I've seen in the past, and there's been a shift about diversity. But when I look at it, and I'm in the community dealing with several groups, I think that more needs to be done on cultural diversity, because what you would think an African is different than a Caribbean or an Asian, or these various cultural component that makes up Massachusetts what it is and how great it is. I've been in the medical field and been working with a specific hospital, and I find sometimes more training in that field needed, not just only with the doctor, but also with the assigned person that is assigned to the patient, because in our culture we say it takes two to tango. And sometimes they don't get it. They don't get the cultural aspect, and it's something that you have to work with. And when we did the vaccine outreach, we found that we had to go down to the crunches and meet the people where they're at. And that is where also that creates that kind of distrust in the community. And it's not because of, as what you say, it's not because of the vaccine. We as Black people and we as immigrants, and let's not forget refugees, because that needs to be included in it. We have always experienced that distrust, and that, you know, people look at us in a certain way and treat us in a certain way. So what's your thought on that? Cultural diversity, not just diversity, because that's the talk that's been happening. Oh, we got to diversify the board. We got to diversify, but they have not dig down deep to say, okay, how can we, one prime example, I could think of a clinic like Springfield, where I saw we had to know how to deal with the various persons that were coming in, because at that clinic we had the Vietnamese coming, we had the Latino coming, we had the Caribbean people coming, and that provider, I won't call names, they were equipped to deal with the various culture that was coming to that clinic. So how do we? Thank you.
Thank you. That's such an important point. Yeah, does anybody want to jump in?
I would love to. Honestly, I would love to answer that.
Oh yeah, go ahead,
Okay.
go ahead.
First of all, I think there's a disconnect somewhere. And first of all, I'm not here by any means to rip any professional doctor down or anybody in the health field. or anybody that has any problem. I'm not trying to do that. That's not what I'm here for. And I know you're not here for that either. But we got to look at this as a human problem. We can't look at this as a color problem or a national problem, or we're not going to say, oh, Asians over here get this treatment, blacks get this treatment. You know? No. Everybody should get the same treatment. It should be great treatment. Right. If you got to holler, kick, scream to get your point across, then do that. You must be heard. If you're not heard, then guess what? You're not going to hear that doctor either. So two people talking at each other at the same time, no one hears anything. Mm-hmm. Let's take all the outside influences out of it. Let's put our heart into this. Mm-hmm. If we're going to make a difference, let's work together. Let's not have side on side, going at side on side, trying to get a pick. Who are we going to nitpick? Tit for tat. We've done that already for hundreds of years. We all see there's a problem. All right? Every day I fight for my life. Every day. But when I get up in the morning, I don't see no color. I don't see nothing. All I see is people and anybody can help. So therefore, I think that it's a human problem. It's a problem for society. Because we can't work together. We always want to point fingers. We always want separation. You know? Didn't we have enough of that? Didn't we have enough?
We did. We did. But I
so
think
let's do it together.
I think to Andrew's point, it's so true. We have to look at the culture. Us being human, that's number one. And anybody that overlooks that, then they shouldn't be sitting in front of me, beside me, or behind me. Mm-hmm. But we have to look at the culture, because I think that it's almost like what they say, if you take a fish out of water, that fish is going to die. So you have to understand who I am, where I come from. I mean, I come from a West Indian Pentecostal background. My grandmother prayed first. Then she went into the kitchen. She got a little bit of this out of that jar, a little bit of this out of that jar, came back, we drank it, and we got rid of the cold. It was as simple as that. She swears it was the prayer, but it was all those things. But if you don't respect that, of where I come from and what it is that I've been trained, what it is that I've been taught, well, then you can't really take me any further with your medicine, with your pills, with your prescriptions, because you really don't know me and where I come from. So I think that the cultural aspect is key, especially when you're a person of color, because we all do things in a different way, and hopefully for the same results. But you need to recognize that difference and treat us accordingly.
I agree with you. But the thing is this. I'm a West Indian guy too.
Tyrone, we want to keep it to
I know,
this person.
I'm West Indian too. I'm a West Indian guy too. Right? But when I'm sick, I'm not West Indian. I'm sick.
I'm a sick West Indian.
All right, thank you. Is there anything you want to add to that, Dr. Ruiz? Okay.
Okay, so I was going to say, or not, that I'm surprised you didn't mention Vicks Vapor Rub, which is the Latino remedy.
That's everybody.
To answer your question, I think to be culturally confident, we really have to strip it down to our shared humanity.
Yeah.
Manners. Looking at somebody in the eye. No matter how many titles you have, what you're wearing that day.
That's right.
I think we focus so much on things that are, of course, important that we evolve. Like, for example, pronouns. We're being woke. Let's put that aside for a second. Let's put that aside for a second and think. Did you say please and thank you?
Yes.
Did you connect with that person as a human? Do you have conversation topics to help you establish rapport? Food, music, sports. Unless you're a Yankee fan, we're good. But basically just saying,
what are the things that you have of your pocket so that we don't lose that capacity of sitting next to somebody on the MBTA and establishing a connection. Once we're there, like everything will work itself out, right? And I think, in my experience as a physician, especially Latina physician, there's only 4% of us here in the United States. We have a lot of work, a lot of catching up to do. My best teachers, I didn't get in school. My best teachers are people that I've surrounded myself with. And I have been humble enough to listen and also to mess up because I didn't always get it right. And I think in that sense, we have to give ourselves a space to mess up. I'm sorry, I forgot what your pronouns were.
That's right.
I'm sorry, help me understand. What do you want me to call you today? Or things like that. It's a matter of being humble, allowing yourself to be human. And with that, errors are part of it. And culture and food and all the things that we have in common. Unless you're Yankee fan.
Yeah, thank you so much for your comments about that. Shakira, did you want to add something?
I think it's great that we're talking about culture and self-efficacy and bringing our whole selves, but we also have to think about these systems and the structural framework of these systems and the idea and the realities of the systematic systems that have been in place for a very long time. And so when we think about that, we need to also come to the table with what are we going to, and who are these people that are putting these systems in place in terms of the atmosphere that you're talking about, the cultural competency. What does their leadership look like? Because if their leadership is effective, then the rest will trickle down. And so what I can say about MACL is we have a great leadership in terms, we're diverse already, but we understand the diversity has to come with more than just being different in culture. Yes. We also have to be respectable of those who are before us. And so there's a hierarchy in the systems when it comes to the medical field, but there's also a hierarchy in our cultural system. And so if we don't have great relationships with those that we get this wisdom and pass down knowledge from, we can't accept that from our medical physicians. And so teaching folks how to understand differences and accept different perspectives is a great way to empower self-efficacy. But we can't talk about self-efficacy without sustainable resources, without sustainable information. And so we can be cultural competent all day, but what does the leadership look like? Is this sustainable?
Thank you, thank you. All right, we can probably take one more question if people have. I'll take you in the back. Oh, sorry, you in the second row, yes.
Hello, well, just wanted to start off and just say thank you for you all for sharing your important stories. Can we give them a round of applause? And I just wanted to echo Ms. Harding. I believe it was you who brought up the point of, it wasn't COVID. And I think that, or it didn't just start with COVID, like the mistrust and distrust didn't just start with COVID. And I think when we, hyper-focus on one incident or even hyper-focus on the past, a lot of people, when speaking of COVID, they referred back to like the Tuskegee study. Right. So when we hyper-focus on things or hyper-focus on the past, we sort of tend to miss the opportunities to address what's currently going on. Maternal mortality is at an all-time high for Black women and Black babies. So I just wanted to just echo that point and thank you for, sharing that and bringing that. But with that being said, my question for you all is just how do we address misinformation on the day-to-day? I know, Aaron, like you spoke to like creating spaces, but what about the opportunities that happen that aren't in space, that happen when you're on the bus and you hear someone say something that's, incorrect. So for the panelists, for the community members, what advice would you give to other community members? And then for Dr. Ruiz, how do you feel as though the medical institution is addressing misinformation and disinformation? So for you, that part, and then for you all, what tips would you give for the everyday interactions and not just in space?
Thank you for your question. I think I need to answer your question with telling you a story about my earrings. These are my grandmother's earrings. And I am wearing them today, first of all, because they're very cute, but also because they are a reminder of her and her presence. And to answer your question about what is the medical community doing, not enough. I can tell you what I'm doing. And what I'm doing is being here and being sure that being present and making sure that I share the story, not only as a Latina, sharing it in my language, making sure that I'm learning every day, including making mistakes. But I also want to put a name and a face to something that you don't necessarily learn in a textbook. And even if you do learn in a textbook, it's very foreign. So here's the story about my earrings. My grandmother was sterilized at age 17 when there was a big campaign in Puerto Rico about mass sterilization. Now, we all know you want to mass sterilize women when you want to control the population because we're somehow deemed less desirable, right? So there was a mass sterilization campaign in Puerto Rico, and doctors were encouraged to sterilize women after their second delivery. Now, why is this important? My grandmother had just had my uncle. It was my mom first and then my uncle second. And my grandfather was serving in the Korean War. And the reason why this is important is because not only was she sterilized when she was a teenager, a young one, of course, but her husband was away. And these are the days where men needed to consent for women to get sterilized. So I am lucky to be here. And when you tell this story to people, it becomes not abstract, but real. This is my story. I wouldn't be here because, like many other children, wouldn't have been here. And the women lost all sort of authority, agency over their body. They altered completely the makeup of the Puerto Rican family structure in the 50s and 60s. We were experimented on. They ran experiments in the poorest Puerto Rican neighborhoods. The houses didn't have even soil. The neighborhoods where they experimented on, one of them was called El Fanguito, which is little mud, because the houses were made, the floor was made of mud. This is not an abstract thing you learn in a book. That's what I'm doing. I'm sharing my story. And in that way, I honor her. I make sure that I don't, I keep informing, and I take this from the abstract to the real, because, like I said, share humanity. There's nothing more powerful than a story.
I think she did it best. Just share a story. That person on the bus, talk to him.
But I also think, too, that one more time it goes back to this whole thing about mistrust, and the fact that it's intergenerational. Because my grandmother didn't trust the doctors, so therefore my mom didn't trust the doctors, so therefore I don't trust the doctors. But when I can sit down and I can look at you, whether you're a doctor, whether you're a friend, whether you're someone I just met, and tell you, well, listen, this has been my experience in the good part of finding a doctor that cares, finding a doctor that looks at you from the head down. And it's not just what ails you physically, but how are you really feeling today? I can sit down to somebody, because I can talk, and I'll find somebody that will hold the conversation with me. And the first thing I want to know from them is, how you doing? Because there's been so much craziness around us. So I think that when it comes down to how do we talk to somebody, how do we engage, it's where do you come from in your heart. People know when you're sincere and when you're just blah, 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 blah. But I think that if you honestly care about somebody, whether it's the guy sitting on the stoop in front of your house or whether it's somebody in a white coat, then you can very easily share a story to get them engaged in a conversation to say, you know what, I feel the same way.
I think it's also important to add that the zip codes that we live in have more of an impact on our health outcomes than our generational code. And so when we come from underserved communities, inequity in our healthcare systems, or disparities within our school systems, or we're overpopulated with police instead of services, we don't get better. And so our health outcomes, that's where those racial disparities come from. And so I think knowing the environment that you live live in and getting to know those communities and those CBOs and those organizations that actually work, that will help to sustain the household. Because we're talking a lot about intergenerational families, but we're forgetting populations who are thriving certain families. We're forgetting about the young children who know English today and who are helping their elders who speak their native language and don't understand these systems today. We're forgetting about the LGBTQ community who's not invited to the conversation because they're not seen as whole persons because we're stuck on stigmas. So when we look at the world around us and we take that in and we use that as a platform to create space, we really welcome in change because we can talk about diversity, but we're not providing opportunity for it.
All right, thank you, everyone. Are there any final thoughts you guys want to share with the crowd about this question? And I'll just say really quickly, we are going to end soon, but you guys will have about 30 more minutes in the space, so if you want to come up at any point to ask the panelists questions, you can feel free to do that, and they'll be in the space with you.
That woman wanted. Yeah,
Okay. Yes.
Can I ask a question? Guys, if y'all comfortable sitting and answering some more of their questions, we don't have to get up. We have a half an hour to stay here. We can sit here.
Can I just say something? I think we need to applaud the audience because it says a lot to be here, not to just listen to stories, but this is what collective response looks like. This is what advocacy looks like.
Yeah,
this
give it up
is
for
what
the
community
audience.
engagement is. So thank you for being here.
And you had a comment?
Oh, he said, hold it.
Hi, I just wanted to add, Dr. Ruiz, she's my director, and I am speaking I'm from Boston Medical Center. I'm one of the program managers, and I know Andrew from the vaccine, and it shows the work that we do at BMC. I'm also a Latina, and I can echo what Dr. Ruiz was saying about the work that we do. Because our director asked us, what can we do different for the community? And we said we need to bring people of color and that look like them in order for them to trust us. So because of that, I was able to put together clinics with Andrew and many others, close to 850 clinics. And Dr. Ruiz said, go for it. And 17,000 people, roughly, of color got vaccinated. And I think that just shows that the public just needs to see, and the community needs to see more people of us outside and put the work in. And I'm a nurse by trade, but now I got this heart of work with the community with Dr. Ruiz to be able to provide more services out in the community, because as we know, COVID will be over in no time, but then what happens to the rest of the community? Mental health is still there. Disparities is still there. So are we just gonna back off? No, we have to keep going and show the community that we still care. COVID is gone, but we're still here. So with all of our work put together, doctors and all, I can speak for my parents. My parents don't speak English, so I am their voice. So now I'm not only speaking for me today, I'm speaking for them, because they don't understand English, but I do. So now people like Dr. Ruiz and like myself, we speak 2 languages. Now we can get the word of medical, transform it into a word that they understand, because we might say it in a different way. So I thank everyone in the medical field, and just wanted to say that we're here for everyone equally across the board.
Thank you so much for your comments, Jessica. All right, so with that, we are going to end the panel conversation. But as I said, you guys can feel free to ask them any questions you have while we're still in this space. We'll be here till around 8 o'clock, I think. Yeah. So yeah, we're gonna end the panel conversation, but there are exhibits around that you guys can go see. We have some videos over here if you wanna watch some of our stories from the people that we're here today who shared those stories. We also have some sticky notes in the back where if you wanna contribute any thoughts or advice on how patients can advocate for themselves or ways that BMC or other health systems can do better to address mistrust. And yeah, thank you guys all so much. I'll pass it back to Catherine to close it up.
So I want another round of applause for our panel and for Kareem. And also, I really want to echo my thanks for each of you coming. I know it's not easy after work, after a long day, and this is hard. It's not easy stuff to think through. The last thing I will just say is, first of all, this is, as we've talked about, this is not the end. This has to be the beginning. Because if we can't take what's happening here with all the wisdom and all of the action and all of the incredible work that has come to this moment, then we are losing an amazing opportunity. So let's seize the opportunity. We have those things that where you can write down your thoughts, but we also importantly have a back table, and we want you to think, where do you want this to go from here? Okay? Because that is actually, we need your collective wisdom. And you don't have to have all the ideas tonight. We have an amazing website where it's also going to be interactive. You could contribute thoughts. And so please, please continue to stay engaged in this dialogue with each other. Let's make the promise to each other tonight that we're all here and we're in it together. And please spread the word. Bring it to 10 of your best friends. Have them contribute, okay? Because I hope that we're here next year and we can say, holy moly, look what we did. So thank you.
All right. Thank you so much, everyone. This conversation, I feel like I've learned so much just from being in this space and talking to these amazing panelists. I hope you guys all have too. As I said before, we have some different interactive activities throughout the event. So we have some videos over here if you want to watch any of the stories that have been recorded. We have some of our exhibits over here in the right corner if you guys want to view some of those. And we also have a space at the back table to contribute any thoughts that you have about what BMC can do better or how we can essentially work to address medical mistrust moving forward. And as Catherine already said, please continue to have these conversations. Take them with you back to communities, your networks, your friends. It's so important that we keep talking about this because for so long, it hasn't been an issue that's been put within the public sphere. So thank you guys all so much.
Thank you. Sorry, one last PS, because we love to lift each other up. So we have a place where you can write notes to any story you read and you want to respond to that person, whether it's a note of thanks, reflection, whatever it may be, because giving a story, as you know, is a gift. So we want to receive it as a gift. So thank you.